with me for one moment here. Very good. So again, we're going to deal today with a couple tricks of the trade of generating revenue through technology, primarily from Practice Perfect. A couple things right off the bat. I'm not sure how long this is going to take. We're not going to exceed an hour, but it's the first time we've given this seminar in quite a long time. So depending on questions, that sort of thing, not sure how long this will take, but it will not exceed an hour, probably less. Number two, all of you are muted, so I can't hear you. The reason being is we can't really have the noise from all of the offices, all of your offices on the phone. It'll distract everybody. If you do have any questions, there is a chat window. You'll see a chat window down below. Use the chat window to type your questions. I will check periodically for questions. So if you type something, I don't reply right away, don't worry. I'll sort of give break times and ask for questions along the way. And again, I'll keep checking that list to see if anybody does have any questions as well. That's part of it. I do apologize if any of this is blurry or fuzzy. Not much I can do about that. That's a GoToMeeting thing. Hopefully it's okay for our purposes today. If any of you have longer questions that are a bit more detailed, more specific to your clinic, we will deal with those sort of offline. I'll make note of them. I'll get support to give you guys a call back regarding them if they are a bit more sort of specific to your installation. This video will be posted after the fact. We're running these today, I think Friday, and next Tuesday. What we're going to do is sort of take the one that I want to say turns out the best. We're going to take one of these videos and put it up on our learning center, on our tutorial center, just to show you where that is. Some of you may not know about it. On our website, practiceperfectemr.com, we have something called tutorials. Well, let's kill that. We're not going to get disturbed anymore here. So basically we have something called tutorials. If I click on from our main website, www.practiceperfectemr.com, tutorials. In tutorials, hopefully you guys have seen this. This is our Practice Perfect University. Every week we're adding new videos, new documents, new how to do things. Our newsletters are here. Hopefully you guys have all been receiving the newsletters. We're doing them religiously every 2 months these days as well. So the newsletters are here. We encourage you to see what's new, but also these webinars we're doing are going to be here as well. So we've already done 2 webinars. The third, this one, will be posted middle of next week. So again, if anybody has missed this, you want someone else to see it, you have to leave early. Again, www.practiceperfectemr.com, click on tutorials, and the webinar will be here as well. As you guys know, you've all seen a newsletter because you're here. Newsletters are available here. We have a July-August one that's going to be coming out as well. Newsletters and the Learning Center, actually newsletters are here as well. So if you actually go into Practice Perfect, you want to see what's new. Most recent newsletter is accessible here as well. One other thing I do want to point out to you that we do have on here, and again, just as an aside, because I do have all of your attention, is we do have, people always say, well, what's new, what's coming up with updates? I don't know if I have the most recent update, that sort of thing. So just before we get into it, we do have another website, www.practiceperfectemr.com/releases, okay, which can also be accessed from Practice Perfect. Release notes takes you to the same place. In releases, you can see what our current release is, what all the releases are. I can go into each one of these, and it will give you a list of exactly what was changed on each one of the releases as well. I can do it by date range. I can do it by category. I just want to see what's changed with reporting, that sort of thing. So again, www.practiceperfectemr.com/releases. And again, you can get there from here as well, from within Practice Perfect. So just while I have your attention, a couple things we did want to take you through before we get into the kind of the meat of the presentation. A couple key websites just to point out to you, practiceperfectemr.com, the Learning Center we just talked about, and the releases as well. So again, if you want to make note of those. One other little sound check just before we kind of jump into the meat of things here. Just anybody, everybody, can you hear me? Somebody just type in the chat window. Yeah, we can hear you. Good. Joy, thank you very much. Okay. Okay, so let's delve into things here. Today's purpose of today is, well, we want to fill your calendar. I mean, you're running a clinic. The clinic's a business. The goal of a business, obviously, is to be busy and bring revenue through the door. And I mean, yes, obviously, we're concerned about the patient care, but we do want you guys to try and generate revenue as well. So while being very good at what you do, obviously, towards your clinic success, there are many ways in which technology can help to build revenue and profitability. So we can use technology, we can leverage technology to help drive more revenue through the clinic. We know that time is tight. Everyone's always complaining that there's not enough hours in the day. Human resource dollars are tight. You're very busy, that sort of thing. So the goal of technology is to try and replace anything repetitive with a computer, with technology. Like why do something that's going to take a lot of your time if it can be done more easily by technology and as efficiently? And we do believe that staff should be focused on tasks that really require that hands-on attention and not spending time, doing things that computers could be doing for you. And that's what we're going to kind of talk about today. Revenue in a rehabilitation practice can be derived essentially from three main sources. Number one, we want to find a way of maximizing revenue for your currently attending patients. That's really kind of the key one. How do we maximize the dollars for your current patients? Number two, patients, when they leave you, we want to make sure if they need your services again, they come back to you. How do we kind of gain that advantage? Not only that, but we want them to tell you or tell their friends about you as well. So number one, maximizing from current. Number two, making sure existing patients return to you. Number three, how can we use technology to generate new referrals? And number four, other ways technology can help kind of outside of Practice Perfect. So these are really the four big topics we're going to be talking about today. So we're going to start with maximizing patient revenue. What are some ways that we can do within the software of maximizing the revenue from your existing patients? We're going to go through all these categories, all these little topics here: catching patient fall-off, making sure patients always leave your appointment booked, future appointment notification, meeting established treatment plans, waiting list, monitoring cancellations, and quick rebooking of cancellations. So we're going to talk a bit about how all of these can be done in Practice Perfect. And I do want to apologize in advance. To some of you, this may be old news. You're doing some of this already. Some of this that may be brand new, but hopefully you'll gain a couple kernels of knowledge out of all of this. So we're going to start with technological solutions for catching patient fall-off. Now, this little eyeball thing, whenever you see that, that means we're going to take a look in Practice Perfect and show you where this actually exists. So the first thing is catching patient fall-off. Patient fall-off reporting. So again, maybe old news to a lot of you, but we do have in Practice Perfect a report under scheduling, patient fall-off report, a key report to run, probably one of the most important reports in the system. Can you please show me all of my patients who I haven't seen for 2 weeks, 3 weeks, 4 weeks, whatever you prefer? I can run this by therapist. And what this report is going to give you is a list of all those patients. I have 23 patients. Here's who they are, why they were coming in, who they were seeing, some of their history. These are 23 patients we've never discharged from the system. We've never said you're done. We've never told them not to come back, but yet we have not seen these people, in this case, since the 2nd of May. Patient fall-off report, key report. This report really should be run, I would think, every Monday morning, maybe going back a couple weeks. If you wait too long to run this report, patients are going to be stale data. They're not going to be of any value. So that's number one. Very, very key, patient fall-off report. Number two, making sure patients always leave your clinic booked. Once a patient leaves your clinic and they don't have another appointment booked, good luck getting them back in. It's very, very tricky. You have a captive audience. The best thing is to kind of, book them while you have them there. And we did put something in here. And again, most of you know about this, but I'm going to show you because some of you may not, is if you see a patient in italic print, Jennifer, Kathy, who else do we have here? David. If you see a patient in italic print, that tells you the patient does not have anything else booked beyond today. The goal is, whether you're dealing with them, clinical people, admin people, if you see a patient in italic print on your schedule, do not let them walk out the door without booking something else. A lot of people see that, they don't know what it means. So a very, very key thing as well. Next thing we're going to look at is future appointment notification. When a client books future appointments, easily produce a takeaway list of appointments. or email a list of future appointments. So again, I'm in a clinic and I've booked a number of appointments with a particular therapist, that sort of thing. Well, there are two things that we can do for the patient that many of you may not know about when they book these future appointments. Number one is if you right click on the appointment, you can drop down. Let me see if I can pick a patient with something here. Maybe I don't have anybody with an email address. There we go. There's an option here called email notification for this appointment. Now, it's not for this appointment necessarily if you've just booked a bunch of appointments. If I right click on this one and drop down to email notification, what's going to happen is a list of all the future appointments for that patient will be emailed out. So in the background, if I was to click right there, bam, right away in the background, an email is going to go out to the patient listing all their upcoming appointments, all the appointments they just booked with you without you having to do anything else. So very, very handy, whether it's one appointment or 10 appointments. The other thing you can do is we do have something up here under Find Appointments, and we can say Pending and Print. And what this is going to do is give you a list that you can actually give the patient of all their upcoming appointments. So again, we can produce a printed list with about 3 clicks for all the upcoming appointments to give the patient, or they can be emailed as well. So something we do encourage people to do, doesn't cost any money. Again, if you want to know how to do that and kind of lost track to where we are, well, we can cover it again. So very, very key thing to do as well. Anything that helps the patients remember when the appointments are coming up. Now, again, a lot of you are using these already, but we do have the automated appointment reminder system, email, text, and phone call. I keep pushing this. It's well worth it. Emails don't cost anything. You can send emails out to everybody the day before their appointments, 2 days before their appointments. Texting, voicemail, voice messages, completely automated. There is a cost. They're about 8 or 9 cents a piece with an outside service. Great way to reduce no-shows and cancellations. The math on these, let's say you're seeing 100 patients a week. It's going to cost you maybe $8 a week for every patient to receive a reminder. If you're seeing 100 patients a week, that's potentially, $5,000, $8,000, $9,000 in revenue. To spend $8 to get even one of those in, well worth it. I'm a big fan. So again, if you don't know about our reminder services, please drop us a note, drop me a note, drop support a note, and we'll take you through it. Question came in from Joy. In regard to the Falloff list, we choose the client attendance list. Okay, so here's an interesting option. I'll take you through this. Thank you, Joy. There is another option in the system other than the Falloff report, because the Falloff report is going to show you patients who have nothing else booked in the future, who haven't been here for a while. But let's say you have patients that were here but have nothing booked in the future. So let's say I was here on Monday, but yet I have nothing else booked in the future. The other option is something called the client attendance report, okay? And this report, similar to the Falloff report, I can say, can you please show me all of my patients that have less than 1 or 2 appointments booked into the future? So it is another option. If you're not as concerned about how long since they've been here, but more show me anybody that has nothing else booked into the future, the other option you can run again is under reports, scheduling, client attendance report, and you can say typically show me everybody with less than 1 appointment booked. Same sort of thing. So thank you, Joy, for that suggestion. Good example as well. Moving along beyond appointment reminders, meeting established treatment plans. Well, this is something new that we are working on right now, and we're calling this a compliance report. We are adding into Practice Perfect the ability for you to say, this patient has been approved for 3 days a week for 7 weeks, 2 days a week for 4 weeks, whatever it is. This new compliance report, going to be available in about a month or two, will show you any patients that are falling short of that. I want to see all of my patients who are not meeting their goals, who are maybe only coming in 1.3 times per week, that sort of thing. They're short by 3 visits at this point. So that's something that is in the works as well, compliance reporting, so very, very key. There'll be more information about that. We also do have a waiting list system built in. Again, I'll show you how it works. It is in here as well. Some of you may be using it, some may not. If you have patients that you can't get into your schedule, whether it's your fault, their fault, whatever the case happens to be, we do have a waiting list function built in. You can add patients to the waiting list, and basically the way it works is a patient can indicate, who they are, why they're coming in, how long their appointment should be, which provider or any provider they want to see. They can specify specific times. You don't have to, but they can as well. The way this works is the patient goes on the waiting list. But the way the waiting list works, let's say you're in your schedule, and in your schedule, someone cancels, someone changes an appointment, someone moves something around. If you do something on your schedule that all of a sudden accommodates somebody on your waiting list, a box will pop up to let you know that it's going to say, hey, I got these 4 patients waiting for 9 o'clock Monday morning. What do you want to do about it? So again, if you guys are running a waiting list, handy feature, it's in here, pops up right away. Obviously, the goal is A, it automates things. B, it's getting patients in faster rather than them having to wait for you to get around to checking your waiting list. So again, waiting list management is another way of generating revenue. Meeting established treatment plans, those patients who are falling off, patients who are not coming in the way you recommended them to come in, great way to generate more revenue. Monitoring therapist cancellation patterns. Quickly identify cancellation rates by therapists that are out of line with your clinic average. And I keep coming back to a very specific report that a lot of clinics don't necessarily run under reports, operations, provider performance summary. Provider performance summary, I always say, is a report that managers and administrators love and clinicians do not. And the reason is because this particular report will show you for each one of your clinicians what percentage of their time was spent with patients, changes in the number of patients they're seeing, and most importantly, not most importantly, but very key, cancellation no-show rates by provider. So you have a clinic with an average cancellation rate of 10%, but yet Daniel's up here at 15%. What's going on? Why is that the case? You need to kind of dig into this. That's a key number. So we want to look at why that's happening. Is he too soft on cancellations? Is Daniel not being great with the patients, being a little bit too hard on the patients, that sort of thing? That being said, I can see here that Daniel typically generates more revenue per visit. Maybe he's putting him through a harder course of treatment. So again, key report, provider performance summary, under operations, monitoring cancellation rates. And as a clinic, you can sort of sit down and say, look, why are our cancellation rates so high? Industry standard seems to be around 10%, a little less for pediatric. So again, very, very key thing is monitoring your cancellation patterns. Quick rebooking of cancellation. So what happens is patients cancel, happens all the time, and and cancel stay is canceled. They don't get rebooked. So just one thing I do want to show you on the 1 second here. I do want to show you on the scheduler, and again, most of you guys know this, but when a patient does cancel with you, we have 2 options. We have cancel, and then we have cancel with a rebook. Okay. If someone has rebooked, we like you to use the rebooking icon and not the cancel icon. The reason being is we can track that stat. We can track a stat that says how many patients rebooked versus cancels. On the screen, you can actually see just as a visual cue, well, look at that. I got 2 people that never bothered rebooking their appointment. I can get a list of all the appointments that have not been rebooked. So we do like you to use the rebook option. If someone is canceling and rebooking, we'd rather you use rebook than cancel. You still get to enter a reason why, they were sick or whatever the case happened to be. So we do encourage you to use that little icon. A lot of people don't know it's there. And again, we can quickly identify who has not rebooked. So again, we want to turn cancels into rebooks, but we have to know which ones those are. That's why that icon is there. Personal opinion, cancellation notification. We get a lot of people that say to us, well, can my patients cancel online? If they get a reminder call or a reminder text, can they cancel online, that sort of thing? I personally, after all of my years sort of being on the other side of things here in rehab clinics, I don't like making canceling easy. I don't like being able to allow patients to cancel via text or email or online. I want them to have to talk to somebody, because chances are, and I'm sure there's a study out there somewhere that shows this, chances are if someone has to speak to somebody to cancel an appointment, they're less likely to do so. people like doing that kind of with some anonymity or without having to speak to somebody. So I'm not a fan of these high-end sort of methods of being able to cancel online. You can do that with the reminder calls or reminder texts, but I'm not a fan. So just my 2 cents is don't make cancellations easy. I remember some clinics we used to work with where they actually turned their voicemail off at night, so the person had to speak to somebody live. A couple other ways of joining or of generating some revenue. Actually, there's a question just came in. Let me take a look here. Question from Sherry here. Are do not attend appointments included in the cancellation percentage? Did not attend are not included there because the did not attend. I think they are. I believe they're on the operations summary. They're on one of the reports. There's sort of less control over the did not attend. You don't know about them until after they've happened. So there's kind of, less that you can do about them. Again, if it's missing from a report, we're happy to add it in. So if it's not there, I'll take a look. If not, we can certainly put it in. Bear with me for one moment here. We just had someone else join us. Another way of, and I'll just make a note of that, PPS did not attend. We'll take a look. We'll take a look into that. Ancillary services. A lot of clinics, not every clinic, sells other product. They sell, ice packs, TheraBands, orthotics, that sort of a thing. You can track this. A lot of clinics, what they do is they do produce some kind of a commission or incentive for clinicians to promote these services. And I just want to show you, and some of you may know this and some of you may not, we do have built into the system a way of tracking that. There's 2 ways to track that. We can, for example, under reports operations revenue report, where are we here? Looking in the right place here. I'm going to do this a different way here. We can track under reports. We'll do the compensation report. You can track product sales. So you can, for example, say, I'm not going to run this particular report here, but you can get a list of every product that a provider sold. And let's say you're doing a commission on that. Let's say we're going to give every therapist $1 for every ice pack they sell, or whatever the case is. That can be set up and reported on. So if you do want to track product only sales for a therapist, for an admin person, maybe you want to give the admin people some credit for that as well, that can be done. So again, if you want to set something like that up, give support a call. You can track this kind of sale and then give people some sort of a reward for it as well. So again, that seems to be working at clinics as well. So we've talked about maximizing revenue from existing patients. How do we sort of make what we call making the patient experience unforgettable, so that they're going to want to come back to you and perhaps refer other patients to you as well? Well, a couple things here. We're going to talk about tracking funding maximums, special events and notations, what we call mid-treatment communication, self-appointment management. That means booking your own appointments, home exercise programs we'll talk about briefly, and then what we call post-treatment communication as well. So we're going to get into all those. Just before we get into that, probably a good break for any questions. Again, if you have any questions, we do have the little chat window down there. A couple people have sent a few in already. I'll give you guys a couple moments just to formulate any questions, that sort of thing, just while I have a sip of water here. If there's any questions, let us know. Okay, so we're going to start with, get my mouse over here, tracking funding maximums. Again, most of you are using this already. This is the ability for you to put in what the patient has been approved for and letting them know when they're approaching the end of that funding maximum. And I would hope that the majority of you are doing this already. That's what this little guy up top here, actually, I'll find a better example here, what this little guy up top here is all about. You can put in, and I really hope you're doing it, whether it's a private self-pay patient or if it's a insurance patient, doesn't matter what kind of patient, you can put in, as you know, under the patient's record, what someone is approved for. I can say, for example, that this patient is covered by, by Aetna, for $5,000, whatever the case is, or 50 visits, or up until the end of June, or whatever the case happens to be. So you can put in all of these funding limits, and then whenever the patient comes in, you will see exactly what is remaining, of their coverage, whatever it happens to be. I guess that's the first payer on file for whatever that patient was. So again, putting in funding limits for patients is great, because whenever you are dealing with that particular patient, you will see what's left of their coverage. Let them know when they are running low. We see this more typically in a couple things. In the US, we see this with deductibles running out, copays. We see this in Canada with somebody being covered for maybe $500 for physical therapy, that sort of thing. So again, funding maximums are kind of key. That's number one, good customer servicing to let people know when they're running out of their coverage. Number two, special events and notations, front and center automated client notes indicating special events. I'll give you a good example of this as well. Again, in Practice Perfect, hopefully you guys are using it for this. Let's take someone empty here, Jennifer. We're going to put a new note in. Right click, up top, blue header up here, right click. A big anniversary party in mid-June, that sort of thing. So somewhere in talking to Jennifer, she has told us that her and her husband are having some big giant anniversary party, sometime in June. So we're going to put that up top here. Again, right click, new note. Key thing. Hey, June, Jennifer, how is that anniversary party? How's your kid's hockey game? How are you recovering from your surgery? Sorry to hear about your dad. I know it sounds kind of cheesy, but these things work, and these appear on any screen, whether you're doing documentation or billing or scheduling, you're going to see these. So I do hope people are using these. They do serve a purpose. People think, oh my gosh, you remembered my kid's hockey game. So again, very, very key that you should be using those. So that is our special events and notations. Mid-treatment communication. This is something we've been alluding to for several months. We're almost on the cusp of launching this. We have something brand new coming. There's going to be separate communication on this called the Wired Client. The Wired Client is an automated system that ties into Practice Perfect that will allow you to set up communication campaigns for your patients. I want all of my patients or my back patients to receive a text message the very first night that they came in. Hey, how was your first treatment? Thanks for coming in. After the 5th visit, congratulations, you've made it through 5 visits. We hope you're feeling better. Please let us know. When they're discharged, thanks for completing your treatment. Please let us know how things went. Click here to take a survey. Maybe 3 months after discharge. Haven't seen you for 3 months. We hope everything is okay. Maybe if they haven't been here for 2 weeks, hey, we haven't seen you for 2 weeks. Can we get you back in the door? So it's all completely automated. You don't even have to remember these texts are going out. These texts will be going out to the patients. They can reply. They can start a dialogue with you. It'll actually show up on your computer screen. So you're using your computer to basically text back and forth with the patients. And again, more information is coming about this, but this is really going to elevate a practice. This is really going to make you top of mind. The dentists are doing it already. It's a constant reminder. Of course, they can opt out of it if they're finding it sort of annoying in any way. So more is coming about that literally in the within the next couple of weeks. Post-treatment communication, same sort of thing. Automated birthday texts, automated things like health exercise tips, clinic events, that sort of thing. So again, wired client kind of stuff. So that's coming. And again, this is really something more and more that people are asking us about. And again, the beauty of this is let's say I come in for a treatment and I'm not feeling well. I get a message that says, thanks for coming in today. I can text back on my phone. Actually, I'm kind of sore. And again, the clinic will get that text message right on their computer screen, and the therapist or whoever can reply to it and say, oh, that's too bad. Let's talk about that. So that's coming soon. Self-appointment management. We do have the ability built into the software already, no charge, for existing patients to book their own appointments online. Some people love this. Some people are not that thrilled with it, just because some clinics don't like doing that sort of thing. It's completely up to you. There's kind of no right or wrong here, but the ability does exist for your existing patients to log in, see their existing appointments, book new appointments, that sort of thing. If you want more information about this, contact our support department. They'll set you up on it. There's no charge for it. They can take you through it. There's also, if you do want to see what it looks like and how it works, on our tutorial site, let me go back there. If you're curious about it, on our tutorial site, I believe, let me double check this. I'm not sure where it would be. I know we've added a video about it. General setup, payers, physicians. It's here somewhere. I'm not sure. I know it's here. I probably should have found it before doing this, but there is a video on here about patient self-booking. Setting reminders, controls, inventory, general. Yeah, I have to find it on here, but it is definitely here. So again, if you do want patients to book their own appointments, here you go. How to use the patient self-booking app. So it is on there as well if you want to take a look at it. But again, I give you an example. I'm a fan of Open Table. I want to go out to dinner. I'm going to go into Open Table, and I'm going to kind of see what's available rather than having to contact the clinic. It takes up time at the clinic for someone on the phone, all that sort of thing. So patients being able to book their own appointments, existing patients, something that's very, very popular, becoming increasingly popular. New patients, we're toying with the idea of having new patients book. The problem with new patients, we don't know who they are. We don't know if they're real. We don't know who they should be seeing. We don't know how long their appointment should be. We don't know if, maybe they're a neck patient and they're trying to book time with the back guy, that kind of thing. So we're toying with the whole new appointments thing. So more to come on that. Again, any information about that, let us know. Home exercise programs, not something that we do. We do integrate with Physiotech, home exercise program. But again, this is something else that elevates the practice. Instead of your clinicians whipping out the little stick man figure and drawing something, home exercise programs do a very nice job of preparing a video or a sheet that can be emailed or given to a patient with all of their exercises. The clinic name is on it. The patients can reply to it. Again, it makes the clinic look good. A friend of theirs wants to go somewhere for treatment. Hey, you should go to my physio clinic. They're great. They communicate with me. I get these cool exercises with videos delivered to me at home. So again, if you do want any information about Physiotech, which is who we integrate with, just drop me an email, and we can set you up with them. I do believe they do a free trial for our users as well. So just before we get to what we call sources of new business, we've looked at patients maximizing attendance. We've looked at making their experiences good through technology and automation with texting and all that kind of stuff. Any questions before we get on to our next area here, sources of new business? Give you guys a moment to type something in here. And again, I will have a sip of water. Okay, so sources of new business. Again, a little harder for technology to kind of help with this because we can't really go out there as a software company and kind of promote the clinic, but we certainly can track what's going on. So sources of new business. Well, referrals come from physicians and other healthcare professionals. Sources of new business come from existing clients, obviously word of mouth. The sources of new business come from marketing initiatives that you've done, whether it's website or yellow pages or flyers or something. The key here is to track what's working and what's not. We're spending money on a website. Is it working? We spent money on this flyer, a bus stop ad. Is it working? So we're going to get into that. So tracking referrals, first thing right off the bat here, tracking return on investment is key to understanding where your dollar is best spent. So I'm going to show you in Practice Perfect a couple things here. First of all, and again, I hope the majority of you are doing this, but in the client record, in the incident, there are two fields. We have a physician and we have a referral source. The intention of referral source is to indicate how the patient came to find you. Now, it may be the physician, could very well be the physician, but it may not be. Physician may have said, maybe Carol goes off to see, Dr. Adams. Dr. Adams says, I really need you to go see a physio. I don't care where you go. I just need you to go see a physio. But then Carol finds you guys from Yellow Pages, website, bus stop ad. This question here, referral source, should almost be, how did you hear about the clinic? And I know a lot of clinics don't put that in here. They put in nothing, or they put the physician. This is really geared for how did the patient hear about the practice. And then we can get reports based on that. Under our marketing reports, for example, we have under marketing, two I'm going to take a look at here. Number one is referral association report. I want to see all of my, maybe everything from the yellow pages for a given period of time. We'll go back in time here, 12/31, maybe up to into last year, that sort of thing. So again, what this is going to show us is all the patients that we received from the yellow pages. Now, again, I ran it for a very broad period of time. Well, we made $106,000 from the Yellow Pages, but again, going back a very, very long time. So this shows us, again, we're spending maybe $1,000 a month on a website. Are we getting those, are we getting value out of the Yellow Pages? So again, key to put in the right information, and then reports, marketing, referral association report, and you kind of pick which one you want to look at. We want to look at our website. Are we getting your referrals from our website or whatever it happens to be, that sort of thing. The other report we want to take a look at with that is something called, under marketing, the referral trend report, another key report. Again, I'm going to go back in time here a little bit here. We'll go back to 2010. What this report shows you is all of your referral sources, including things like Yellow Pages, along the side and months along the top. Well, it's interesting. So maybe we know that we're doing really well with the Yellow Pages or with our website, but it's interesting to see month over month. Let me just see if I can scroll down to something more meaningful here. It's interesting to see month over month. Let me just run this going back a little bit of a ways here, how things are doing. So, maybe, for example, we're doing really, really well with our website in January through May, or the Yellow Pages through January through May, but then maybe things are trailing off later in the year. This is also good to see if there's a problem with a particular referral source. Maybe there was a certain doctor, Dr. Sloan here, that was a constant referral source, but maybe he's dropping. Like maybe he was doing 10, now he's doing 8 and 7 and 5 and 4. So this is another key report to indicate if there are any trends with your referrals that are a problem. This report's also good because we can see the total number of referrals month over month. So if you're trying to look at staffing and which month, maybe you need a locum PT or something like that, I can see that, August it gets slower, November gets slower, whatever the case happens to be. So you get a good, especially when you have more data, you get a good indication of basically when, referral patterns, that sort of thing. So again, key to drawing new revenue through the door is tracking what's working, what's not. If something's not working, then ditch it, that sort of thing. Now, on kind of a non-technological or not non-practice perfect thing, and again, hopefully most of you are doing this, social media, key thing now. Things like Yelp, Twitter, Facebook, whole completely separate discussion. You can, quite frankly, blow your brains out with that sort of stuff. And we may actually bring some specialists in to do some seminars on that sort of stuff as well. But I can't tell you how many clinics that we deal with that either A, don't have a website, even the simplest of websites, 2 or 3 pages with just some information about the clinic. And more importantly, how many clinics don't have a proper email address. It just looks unprofessional when the guy down the street may have something that looks like a really swanky website that costs nothing to put together. And we're still seeing Gmail, Hotmail, that sort of thing. It costs maybe $10, $20 a year to have a domain name with your clinic or something close to your clinic. So really, really, we stress this. Doesn't have to do again with Practice Perfect, but it really, really makes a big difference. And it's probably, for a simple website, less expensive than you think. Again, Google, Facebook, LinkedIn, Twitter, obviously pricier. But again, people are counting more and more on Google these days. Even if they have word of mouth, they're still going to go Google you. And it's good on your website. Maybe have a picture of the clinicians, a bit of their bio, that sort of stuff. You can certainly have, the link for existing patients to book appointments online on there as well. So again, we're big fans of this. If some of you are sitting on the fence, what do we do with this? Well, maybe Facebook's not as crucial, depending on your organization, but certainly Google, that sort of thing. So certainly something worth investing money in as well. Something new that we are working on, again, has to do with that sort of open table model for new patients. And most of you, or some of you know this already, is the ability for clients to register remotely. Patients being able to enter all their information online before they come through the door. So we now do have forms online. If you do want your patients to be able to fill out their consent forms, their intake forms, online before they come in, that can now be done. The forms are emailed to you. We're working on a further integration with that. But again, it makes the clinic look more approachable. It's self-service. That's the whole point here. We want self-service, the ability for patients to do things on their own. It's certainly makes the clinic more appealing. If I'm looking at two places, all things being equal, I'm going to do the one that gives me the most self-service as well. Appeasing your physicians. So we talked about patients being able to kind of book their own stuff online or being able to get their forms online, finding you, that sort of thing. Physicians are a key source, of, obviously, as well, of referrals. Well, what can we do for the physicians to kind of send clinics or send patients to you? Well, obviously, they want the path of least resistance. They don't want to hear anything bad. They want to know they're going to get taken care of, that sort of thing. So there's a couple things we can do for physicians as well. Number one is, again, if you're not currently using the EMR portion of the software, which is doing your daily notes, doing your valuations, it's a good thing to start doing because everything looks nice and uniform. You can fax directly from the system right to the physician. So again, you can make it nice and concise. So we do encourage people to use the EMR and the software, the medical records. It's already there. You're already paying for it. So again, just speak to support if you want more information. But we also do have, we also do have stats that are available. If you're going out to see a particular physician and you want information about their patients, we do have built in something called under Reports Operations, the Treatment Statistics Report. I'm going out to see a particular referral source. Let's say Dr. Sloan. Let's see if we have anything in here. And I want to see, for the past year, the past 5 years, whatever, I want to see all the information about Dr. Sloan's patients. So this treatment statistics report is going to show me all the patients that came from Dr. Sloan or related to Dr. Sloan. I can see, for example, when they were injured, when they contacted us, what's the number of days between them. We don't have any injury dates here. I can see how long it took us to get people into assessment. So looks like we're averaging, I mean, we have some outliers here, but it looks like we're averaging not too bad a number. I mean, typically, well, not great actually, 1, 6, 4, 12, 37. So we can say to Dr. Smith, we're taking an average of 16 days for, for patients to get into the clinic, whatever it happens to be. We can see for Dr. Sloan how many patients completed treatment, how many self-discharged, how many wandered away on their own. So we can say, look, Dr. Sloan, 20% of your patients complete treatment with us, which is pretty lousy. We can see on the same report for Dr. Sloan, hey, Dr. Sloan, 26% of your patients are here 3 to 5 visits, that sort of thing as well. So we can show them that sort of stat. We can even get into more details. If you're recording injury types, we can say, hey, Dr. Sloan, your average cervical spine patient is here for 6 visits at a cost of $1,400. So again, you can get a lot of information by physician as well if you're going out to see them. And again, it makes the physician feel respected, that sort of thing. It's all about sort of appeasing the physician. So that's there as well for you. We call these geographic holes. Where are your patients coming from? So this is an interesting one. In the software under client listing, someone just joined us. I have a feeling someone got their time zones wrong. Session was for noon Eastern. I suspect that you think it's for noon Central. I apologize. So again, under reports, marketing, client listing report, we can do something called a zip code breakdown here. So I can say, for example, where are we here? Zip code analysis, or postal code if you're Canadian. So I can say I want to see, for all the patients that are active or whatever date range, it's going to give me a list of all the patients. But at the very bottom, it's going to give us a breakdown. Where are we here? It's going to give us a breakdown of all of our zip codes or postal codes and how many patients came from those postal codes. So we can see, is there a particular postal code where we should be getting some information or some patients and we're not. We're actually looking at integrating this with Google Maps as well. So you can actually see it on a map. But again, if if there's a certain zip code, postal code you should be getting patients from and you're not, this does show it. And again, just to reiterate, where was that? Reports, marketing, client listing, and we want to see zip code analysis. And we can say, I want to go to the 3rd digit, the 4th digit, the 5th digit, the 6th digit, depending on if you're using zip codes or postal codes. You don't want to go maybe to the, actually zip codes fourth or fifth digit, postal codes maybe third or fourth digit, that sort of thing. So again, that's in there as well, just to see where potentially any business could be missing. Other ways that technology can help, kind of wrapping up here, things like rewarding admin staff for accounts receivable collection achievements. You know, if we want to get more money through the door, let's set some benchmarks. Let's set some goals for accounts receivable. Reward clinical staff for low patient fall-offs. Maybe there's a reward for the physical therapist that has the least number of patient fall-offs in a given month. Productivity we're tracking and provider performance. Rewarding clinical staff for timely completion of daily notes. We can run a report that shows how fast notes are done each day. All of this makes the clinic run better. It's kind of gamifying the clinic, that sort of thing. Rewarding all staff for meeting customer service goals. Rewarding all staff for meeting revenue targets. And again, all this can be reported from Practice Perfect. Reward staff for data collection. All sorts of things you can be doing. So again, hopefully there were a couple little nuggets in there. Hopefully there's some new stuff for a few of you in there as well. Any questions? I have a couple, one or two wrap-up comments as well. But any questions about any of this, feel free to type them in the chat line. We are looking for ideas for more topics for these seminars. They've been pretty popular. We're looking at we've done one on reporting already. It's been posted. We've done a couple ones. We're looking at doing one on new changes, things that have happened as well, that sort of thing. Oh, we have a reminder in Practice Perfect. We'll just kick that back. So again, we're looking at doing other kinds of seminars. If you have an idea for seminars you'd like to see done, please let us know. You know, suggest it. If it's a good idea, we'll put them into our our seminar rotation. Any questions at all, type them. I'm going to stay on the line for a couple minutes. I do appreciate everyone attending today, and hopefully you did find some value in this. This will be posted probably middle of next week as well onto the tutorial website. So again, thank you all very much. And again, I shall just sit here for a couple moments and look for any questions. Just type them into the chat window. Again, my email address is there as well if anyone has any questions, by all means. Okay, again, I want to thank everyone for coming. And again, I'll stay on the line for a couple moments for questions. But thank you very much and have a good rest of your day. For those of you that may still be here, there were a couple questions that came in that we didn't see for whatever reason. They didn't show up on my thing here. So I'll see if I can address a couple of them here. Elizabeth, I think you're still here. You had a couple questions. It'd be great if we can give you an alert when you are close to the end of visits or funding. Problem is you have to be looking at the patient for that alert to come up. If you don't have the patient on the screen, you're not going to see the alert. And if you have the patient on the screen, you can sort of see the funding anyway. Different clinics will want different thresholds for that. So wouldn't be a bad idea, but it needs to be a meaningful way to do it. My concern is if you don't see a patient, you're not going to be aware they're coming up on the end of things. Main way, will this mid-treatment communication be included in a regular monthly billing? The wire client, no, it will be an add-on charge. We're still trying to establish the pricing on that. That was from Mainway. Sherry, are there pediatric exercise programs? Sherry, I'm not sure if you're still there. I think you are. Contact Physiotech, physiotech.ca, physiotech.ca. Contact them or contact me. I'll put you in touch with them. They can give you a list of pediatric exercise programs, and there's a trial with them. Elizabeth, topic for future webinar, creating your own evaluation templates. Great idea. We do have a video for that now. So Elizabeth, if you're still there, on our tutorial site, we do have, where are we here? We added it not too long ago. Where are we here? How to download and install integrated forms. How to create custom clinical documents in Practice Perfect. So we do have 2 videos on how to create clinical documents as well. So feel free to check those out. But again, good idea for a future seminar. Let me check here, Elizabeth. I think hopefully I addressed them. Sherry, if you add a new referral source after the patient's first appointment, will it be reflected in the month the patient first started or when the referral source was added? If you add the referral source after the fact, go back to the patient and put it in, it will reflect on a previous report. So it is retroactive. I come in, you add my referral source a month from now, you run the report for now, for when I first came in, it will be reflected on that report. I hope that answered the question. And also main way I answered their question. So hopefully I got everybody. Sorry, I didn't see those. I don't know why. Everybody got their information, I hope. Elizabeth, I hope there was a couple for you in there. Sherry, a couple for you in there. And we'll give you guys another minute if anything else comes up. I think I got all the questions. I'll just double check. Okay, I think we got everybody. Thank you guys all for attending again. And we will speak to you soon. Take care. Bye.